Hello and welcome to my channel, Silver Lining. My name is Peter Abraham. I'm a hospice registered nurse or a registered nurse with lots of hospice experience. This is live, so there's no editing. I do have a helper that's been with me in a number of the videos, but behind the scenes. Her name's Bonnie, rescue dog from Texas. So in this episode, I do want to mention I did get endorsed by the Kentucky Board of Nursing for my Pennsylvania RN license. So I was pleasantly surprised when Friday I had emailed uh, through their secure app just asking for a status of the fingerprinting results, not expecting that they would have a series of replies. I don't know where your license is at. Oh, it takes 3 to 4 days. And the next thing you know, you're endorsed. It's like, so that was pleasant news. So I am looking for work mainly as a hospice nurse or palliative care nurse, part-time preferred. But we'll see where that goes based on the Lord's will. For this episode, I did want to bring up some resources for those of you who are in healthcare, whether you're a med tech or a CNA or a PCA, LPN, RN, maybe you are in hospice or you're like one of my nursing colleagues, Amy. Amy, if you're watching this, I admire you. Amy was a person who graduated. I forget whether you graduated either before me or just after me. But she's worked her way from med surg to PCU. Wonderful nurse, and she's been trying to encourage me to develop some resources to help hospital-based nurses to do better at conversations with families, speaking about end-of-life topics, as well as to know you're not killing the patient when you give them morphine, whether it's IV or oral morphine. So this is not the kit and caboodle, so to speak, for that training. For those of you watching, if you're interested in learning more, what I'd appreciate from you, outside of the like and subscribe business, is write in the comments, what would you like to know most? What's your most pressing topic? And either A, I might be able to answer you in the comics, or B, very similar to what I offered for Amy, I could set up a Google Meet and we can talk in a Zoom-like fashion. Um, Initially, this would be completely for free. I'm not trying to sell my time, but depending on what happens, maybe it's a matter of you're contracting for my time. I don't know what the future holds, but at this point in time, I'm willing to offer my time freely, just to encourage those, because I believe if we help one another as nurses, we're going to bloom and we're going to grow. If we help one another as nurses, we stand up for one another and we encourage one another. We don't eat our young, we don't eat our old, but we help each other bloom, we will grow. So, what I want to address in this episode is just a small handful of resources. Three of them are books that I wrote out of several, but I do want to highlight some key points because Amy brought up about both recognizing when somebody might need hospice. Amy brought up about how to encourage fellow coworkers that if you give that morphine, whether it be IV or oral, I like going buccally or sublingual, but I prefer buccal. You're not killing them. You're not making them die faster. And having those critical, very difficult conversations with loved ones about family. Now, this is not a training session for right now. I just want to go over some resources that are available. So the very first one is something that was handed to me when I first became a hospice nurse, Gone from My Sight, The Dying Experience by Barbara Carnes. Now, Barbara, if you're watching this, you're one of my living heroes. I have a number of those, both patients who have passed as well as those who are still alive, and fellow nurses. Barbara Carnes is like the Florence Nightingale, but she's still alive. And she's publishing a number of wonderful booklets. They tend to be about this size. They're rather small, but they're very concise and they can be very helpful. And when I first became a hospice nurse, my mentor handed me, as part of the orientation, here, you're going to learn from that, which I did. Barbara Carnes is a wonderful author. One of the books I wrote to complement her work is Whispers of Time, Understanding the End of Life Timeline. Barbara Carnes basically gives you an outline of what to expect as part of the dying process. 1 to 3 months before death. Goes over food, goes over other items, 1 to 2 weeks. And it's a bird's eye view done extremely well of the dying process, including a summary towards the end. And this is a very wonderful resource. It's something that most hospice agencies will hand out to family members. It's a wonderful experience. It's a bird's eye view. Not every patient will have everything mentioned in the bird's eye view. Speaking of bird's eye view, where we live, we just had some security cameras installed, and I saw an alert. And it's a smart camera with some artificial intelligence, which could not always be right on target. A dog, a pet, triggered it. And I watched the entire video and it was blank. So sometimes bird's eye view, there was no bird. There was no squirrel. There was nothing there. So not every patient has modeling, for example. So in the book Whispers of Time, it goes over from a hospice nurse perspective, looking at the art of observation and interviewing. One of the lessons that I've learned in doing hospice for 6 years is the patient and the family, the caregivers, how you interview. That if you've anyone fresh out of nursing school and you had your assessment class, Harrisburg Area Community College, I think it was 142, your assessment class, that interviewing questions are unbelievably important for not only establishing baselines and trends, comparing and contrasting, but seeing where are they at now. So it goes over the art of interviewing. It goes over how to utilize all of the senses, including the sense of smell, because somebody who is in their last month of life will have a different odor to them than somebody that's 6 months away. And so there's an art to this. It's not only a science, but an art. So this goes over, it's not that much bigger than the pamphlet, but it does go over the printed book is 40 pages long. It does go over in a little bit more detail what to expect. So it's, I wouldn't call it a zoom lens, but if you were to take the bird's eye view and you say, I want to get a little bit closer, it may be driving distance away. This is a resource for you. If you're a person looking at hospice admissions or you want to know more about hospice eligibility, this is a deeper dive. This is a deeper dive. So when I became that hospice nurse, when I started, and I got handed Gone with my sight, my manager also handed me this, the hospice quick flip guides on eligibility. And everything is in outline format, and it only gives you the major guidelines. And it doesn't handle the what ifs. It doesn't handle trying to help me or other hospice nurses to think out of the box. And for any fellow hospice nurses, if you've been doing this for several years or decades, you have to think out of the box. You have to be a type of MacGyver in hospice to do well. And this is something you develop. So if you're hearing this and you're a brand new hospice nurse, don't panic. You will develop this over time. Give yourself grace and patience. Be patient with yourself. Ask questions of your mentors. Reach out for help. Comment on this channel. I certainly don't know it all, and I'm not going to claim to know it all. But if I'm able to help you, I'll help you. But I wrote Mastering Hospice Eligibility for a deeper dive to try to help my fellow hospice nurses and anyone else interested in hospice eligibility. What about those cases where they're not covering the local coverage determinants, the LCDs? This book deals with the LCDs. What are the government LCDs, the standards of care? Those standards matter greatly. They're significant. But human beings are not a book. When you go to admit a patient, they're not going to fit a book. They're going to be different than any book that you've ever read, including this book. This book is about helping you learn how to think out of the box. And it does go over the different eligibility requirements. Understanding the general guidelines for prognosis. It goes over different scales, like the Bode Index. Some of these scales, until I wrote this book, I was not aware of, and like, gee, this really helps me prove my case. I can prove my case. Renal disease, sepsis. It goes over all of the known cases that I've encountered, but also how do you deal with cases like I've not encountered this before, but my gut is telling me when I've interviewed them and I've assessed them, I know in my gut they have 6 months or less to live. And you've probably had cases, if you're watching this and you're a hospice nurse, they may not make it to tomorrow. So this book helps you go over how do I think out of the box and how do I get them admitted correctly. We're not talking about fraudulent admitted, we're talking about admitting them correctly. And then the other resource out there that is a relatively thick book, and Amy, this is a book that I would recommend in terms of like learning. This is not just for hospice nurses. This is for anyone who wants to know how do I have those conversations with families about very difficult topics. Now, the brief clip that you just saw just went over the covers of two of my books and gone from my site, but also goes over some key pages that's in the book Conversations at the end. There's a framework that we utilize that becomes second nature the more that you do it. The Spikes protocol, that's the looking at the setting that you're having these conversations. You want to maintain privacy and dignity. Every person that we talk to deserves respect and dignity. And so just like when you learned as part of nursing clinicals, when you go to work with a patient, you want to make sure that their privacy, so their dignity is maintained. When you have certain conversations with families, you need to bring them away. And to give you an example of this, I had a case of an end-stage stroke patient. And this was hard for me because I get to know people, small no, at their hardest time in their lives. And when I get to meet them there, the overwhelming majority of the time, I'm like, wow, I would have loved to have known this person years ago because they're a wonderful, amazing human being. So there was this lady who had worked in the military, served our country faithfully, traveled the world, and herself a nurse. and she had a stroke, and so she came back in end stage coma. In this case, in and out of consciousness. I mentioned Ambassador in the eligibility. She was an odd one for end stage stroke, end stage coma, just because there was a period of time where she was able to communicate with blinking eyes, with nodding heads. She had a slight recovery of mumbling, but I knew she was going to be tanking soon. And this is where you get to know the signs early, middle, late. But I was present to do the admissions. I've done the majority of the field work in hospice. I've done it. And so I was there. I went, made sure that the room was ready. She was coming back to assisted living. Made sure the room was ready, that we had everything set up that was needed. Made sure that the nursing staff and the care staff at the facility was prepared. Had everything that I could do in advance ready. And so the ambulance came, and in between, because I'm meeting the ambulance at the entrance to the facility, but in between, I don't want to say they snuck in, but I didn't recognize that the family came in and went back to the room. That's fine. And so when I went back there with the MS to help them transfer her from the stretcher to the bed, transfer the oxygen, and work with them to get everything set up, the family members talking rather loudly, and one of the family members saying, well, what are we going to wait and handle this when she was dead? In a very loud voice. And I had to politely, she's here now. She can hear you. Hearing is the last sense to go. Can we please take this conversation outside? It wasn't the perfect Spike's scenario. I couldn't head them off at the pass, and this is stuff that you're going to run into, the unexpected. But I got them to go to a private area where I could sit down with all the family members once I got the patient situated and made sure she was comfortable. I went out there to have the conversation with the family. So Spike's protocol, S is for setting, P is for perception. You're assessing how they're perceiving things. So a lot of this is watching their body language very closely. Active listening. Open-ended question. Pause. Wait, even when it gets uncomfortable. Proceed slowly. This is a sensitive, solemn topic. So spikes. S for setting, P perception, I invitation. Part of it's asking is, is it okay to share? So I went out to speak to the family. Already had them at a private place. I'm already checking out the body language. Some of the family members is like a half a dozen, maybe a little bit more. Some of them were very calm. Several of them were very noticeably upset at the person who spoke loudly. What she all, we're going to handle this after she's dead. So I made it a point to look directly at that person, saying, I'm sorry if I raise my voice slightly. Hearing's the last to go. We need to respect her, and I want to know I'm respecting you. I apologize if I came across wrong. Is it now okay? And I'm looking now around all the table, including that person. Is it okay we discuss what's happening and what we can expect? And once they gave me their nods, then I have the invitation. Then I'm assessing their knowledge. What do they, before I even got into what do you know about hospice, this is where as you get, the more you're doing this, you'll know what knowledge points to assess in what order, because it doesn't follow a script. This is a live video. I'm not editing. It's very similar. It's not following a script. So here I'm asking, what was she like before she went into the hospital? Now they were there when she got brought back. And even though they didn't stay too long because of the commentary that was made, said, you saw what she looks like now. And I'm pausing, allowing them to ask questions. For almost all the time it happens, what about diet? So we go over, here's the discharge summary, and here's what I'm going to do before I leave. And if you're still here, I'm going to come back and I'm going to update you. But I ask those questions first to try to get an idea of like what they're seeing, what they're witnessing, and are they emotionally stable enough for me to go to the next topic. Hospice is about comfort. Hospice is about comfort. Palliative care is about comfort. We're not just talking comfort for the patient, but it's also comfort for family, friends, and other ones that are loved. So I'm not there to distress anyone. So I assess where they're at with what they just saw, and I answer their questions. Then I'm asking, what do you know about hospice? And I'm letting them answer. These are open-ended questions. And then I'm answering those questions. And then I'm empathizing. I'm going with their responses. This lady was walking and going to different activities, helping other residents with their nursing knowledge, not practicing per se. But if you've ever been a nurse, you're always a nurse. And this is no different. So I'm empathizing with them. And then I'm summarizing, I'm sharing what's going on, such as, she's at end of life. I'm admitting her end of life. We are going to be coming every single day, 7 days a week. It won't mean necessarily me 7 days a week unless I pick up a weekend shift. Who is the primary point of contact? And I work through those. And we have that conversation. She might pass in 2 weeks and it might be a month. At this point, this is my first time seeing her. I'm telling them as bluntly, but with care as I can. So I mentioned spikes briefly. And but this book also goes over the nurse method. And that's looking at another way of sharing news. That's the dog, Bonnie, going out. You didn't know dogs can open doors. But it goes over how to handle communication via the nurse method. And the book handles strategies for overcoming barriers. So when I talk about that I write books to help people, my fellow nurses, is to try to give you the tools to do your job effectively, especially when, at least when I became a hospice nurse, and I love my mentor. It's an interesting relationship where I didn't like how something happened because my primary mentor is the one who did not stand up for me the first time I was let go. This was the face shield episode, for which I have a medical exemption. It's actually one of the saved items on my board along with my nursing certificate and diploma. But Tara, if you're watching this, I still remember all of the training that you provided. But a lot of times when you do receive training as an entry-level hospice nurse, it's kind of phrase. You get maybe 1% to 2% from the orientation, and 98% is going to be out in the field when you're on your own. And the hard part about that, and I'm being brutally honest, you're going to run into a situation that there's nothing that you've ever read, watched, heard, and now you're a MacGyver. And you're doing your best to have that game faced of, I am not going to cry in front of them. I'm not going to panic in front of them. I'm going to work through the nursing process, the ADPI. And I'm going to utilize my resources. And I'm going to grow from this. So where I'm going to end with this, if you like this video, like. If you subscribe and want to see more, subscribe. But if you are a fellow healthcare worker and you have questions that you'd like to have some answers to, and if I'm able to answer them, I'll do my best to answer them. And maybe we could do a Google Meet or something like that for free, not trying to have you buy something. Granted, it'd be nice if you buy the books if they'll help you, but you do you. But thank you for your time, and God bless.